Okay, welcome. Welcome to Your Body, Your Baby, and Healthy Blood Sugars class. My name is Amanda Lungren. I'm a dietitian and a diabetes educator here at Island Health. So today we'll be talking about gestational diabetes, preventing gestational diabetes, having healthy blood sugars during pregnancy. And here are our class objectives. So we'll discuss blood sugars in pregnancy, what exactly gestational diabetes is. We'll also review nutrition and physical activity recommendations. We'll review ways to encourage healthy blood sugars during your pregnancy. And we'll also discuss next steps if you happen to be diagnosed with gestational diabetes. So blood sugars in pregnancy. Insulin needs change during pregnancy, mostly because our bodies change during pregnancy. So along with the increase in weight, which can impact how your body uses insulin, there's also an increased need for insulin. So even women without gestational diabetes, need more insulin during their pregnancy. In fact, the body's ability to use the insulin that they produce adequately is reduced by about 50%. And the sugar in your body can increase. So your body's ability to make sugar can actually increase by 30%, usually somewhere in the third trimester. So this indicates that even in healthy pregnancies, women without gestational diabetes, that the pregnancy actually requires this increase in insulin, particularly in the second and third trimester. It's just that when women aren't diagnosed with gestational diabetes, their bodies compensate for that extra need. So due to these changes in pregnancy, which we'll talk a little bit more about how the placenta is involved, there's this insulin resistance and this increased need for more insulin to help with blood sugars. So how can high blood sugars impact mom? Well, it increases risk of preeclampsia, which is can be a very dangerous diagnosis during pregnancy that involves high blood pressure. It also increases chances of C-section delivery because baby can become very large with mom having high blood sugars. It can sometimes become difficult to deliver vaginally. And it increases chances of type 2 diabetes for mom later in life. How do high blood sugars impact baby? Well, baby can sometimes be born early. Also, baby, as mentioned in the last slide, can be born very large. So 9 pounds or more would be considered macrosomia or a large baby. And this happens because if mom's blood sugars are high, what happens is baby gets exposed to those blood sugars, and whatever baby doesn't use for development and fuel gets packed on as fat tissue. So it makes baby larger. Also, baby might be at risk for low blood sugar after delivery, and that is primarily because if baby is surrounded by lots and lots of sugar in utero or while mom is pregnant and then is delivered, that baby won't be used to will be used to having lots of sugar, and then suddenly will not have access to that sugar and can have a low blood sugar at delivery, which is usually treated, the nurses would treat that with like a glucose gel. Also, baby will not be born with type 2 diabetes. That's not what happens. However, if mom's blood sugars are high, baby can develop type 2 diabetes later on in life. So what exactly is gestational diabetes? This is a type of diabetes that occurs only during pregnancy. And basically what's happening is your body cannot make enough insulin that's needed during the pregnancy. Nearly 10% of all pregnancies in the United States are affected by gestational diabetes. So the primary problem happening during gestational diabetes is something called insulin resistance. So what happens is as we eat any kind of carbohydrate, which we do need some carbohydrates during pregnancy, those carbohydrates are turned into a sugar called glucose. And they're represented here on this slide by these little white balls, right? So those are glucose or sugar in your blood. When your body detects that there is sugar in your blood, your pancreas starts making a hormone called insulin. And that insulin acts as a key, as represented here by these little gray keys, to open up our cells and move that sugar out of the blood and into the cells to be used as fuel, right? So those cells could be our brain cells, our muscle cells. They help us think, they help us move, exercise, not be so tired all the time. And the insulin helps move that sugar in there to be used. With insulin resistance, what that means is the key shows up to open up the cell to move the sugar in, but the key doesn't work. The key is almost jammed, right? So the cell cannot open up, and that glucose gets stuck in your blood, causing a high blood sugar. And part of this insulin resistance, or your inability to move that sugar into the cells, is because of the placenta making these pregnancy hormones cause insulin resistance. So we know the pregnancy hormones that are developed from the placenta are really healthy and needed during our pregnancy, but it can increase insulin resistance during your pregnancy, especially in the later half of it, so the second and third trimester. So what are some risk factors for gestational diabetes? If you come into your pregnancy at a higher weight, you may be at higher risk for gestational diabetes. If you have family history of diabetes, like a parent has type 2 diabetes, you may be at risk for gestational diabetes. If you have prediabetes or polycystic ovarian syndrome or PCOS, you may be at risk or an increased risk for gestational diabetes. And how do we diagnose gestational diabetes? Well, a lot of times women don't have symptoms. And if they do, it's hard to determine if those symptoms are actually diabetes related or pregnancy related, because sometimes the symptoms are things like increased urine frequency, right? Your need to go to the restroom increases, or you become extra tired or fatigued, which those are also pregnancy symptoms. So it's hard to determine if that's really diabetes or is it just from pregnancy. But the way that we diagnose it is usually through a two-step process. So first is the glucose screen. So you go into the lab and you drink a sugary beverage and they check your blood sugar 1 hour later. If that number is above 140, then they would say that's a positive screen and you go on to the second test. If it's below 140, then they would likely say, okay, you don't have gestational diabetes. If you go on to the second step, that is a 3-hour OGTT, or oral glucose tolerance test, at which time they check your fasting number. So before, you haven't eaten anything, you haven't had anything to drink besides water. Then you drink the sugary beverage. They check your blood sugar at 1 hour, 2 hour, and 3 hour. And if 2 or more of those values are elevated, then they would likely diagnose you with gestational diabetes. So with gestational diabetes, if someone is diagnosed with that, this does increase risk for type 2 diabetes. In fact, about 50% of women go on to develop type 2 diabetes within 5 to 10 years postpartum or after their pregnancy. Usually women do not have diabetes necessarily after baby is born, right? So after the placenta is out and we no longer have those pregnancy hormones on board, blood sugars tend to normalize. The women generally, about 90 to 95% of women don't have diabetes right after having gestational diabetes. It's that increased risk 5 to 10 years later on down the road where somebody can develop type 2. So how do we reduce our risk for gestational diabetes? Well, one way is nutrition, right? So plate method, which we will discuss. We'll talk about carbohydrates. We'll talk about protein, fat, fiber, and fluids. So here's plate method. This is the easiest way to manage your food intake. And this is what's recommended: about half your plate non-starchy vegetables. So that would be vegetables like salad or carrots, tomatoes, cucumbers, beets, celery, whatever non-starchy vegetables that you enjoy. A quarter of your plate protein. So somewhere around 3 or 4 ounces of a lean protein like chicken or eggs or tofu or fish, or lean cuts of beef. And then a quarter of your plate whole grains, starchier foods, like it can be potatoes, it could be brown rice, whole wheat pasta. So watching the portions on that specifically about a quarter of your plate. Usually this ends up being around a cup or so at a meal. In terms of carbohydrates, the job of carbohydrates is to supply the body with energy, and it's in a lot of foods that we eat. And it is recommended to have some carbohydrates during pregnancy. This food group includes starches, grains, fruits, some vegetables, milk, yogurts, and then of course any foods that are particularly sweet. Carb counting is one way that you can manage your blood sugars, and basically you use a set number of carb choices with meals and snacks to allow for consistent blood sugar levels. So usually during pregnancy, the recommendation is somewhere around 30 grams perhaps at breakfast, and then at lunch or dinner, no more than maybe 45 to 60 grams, depending on your blood sugars, depending on your own height, weight, and things, and weight gain during your pregnancy. But we always want that breakfast to be the smallest meal of the day, and then lunch and dinner, and then snacks in between as needed. So eating somewhere between every 3 to 4 or 5 hours. So when you're carb counting, one thing you can obviously incorporate is label reading. So the first thing you want to do is look at the serving size and the amount per container. So in this particular label, the serving size is 1 cup, and there's 2 servings in this container. So if you ate the entire container, we would multiply the nutritional values below by 2, versus if you only had half or about a cup, we would follow what is stated here. So for blood sugar specifically, we're going to look at total carbohydrates. We're not going to look at just sugars. We're going to look at total carbs, which on this label for 1 cup of this food is 31 grams of carbohydrates. You can subtract the fiber because fiber is included in total carbs, but it does not increase your blood sugars. And we don't want to do anything with those 5 grams of sugars. That 5 grams is already included in the 31 grams. So technically you could say that 1 cup of this food equals about 28 net carbs or 28 grams of carbohydrates that would affect your blood sugar. These areas will indicate how many carb choices are in 1 serving. So 1 serving is, we count it as 15 grams. So there would be 2 servings in this one, since it's around 30 grams, which would be okay for most women during pregnancy during a meal. It would in fact maybe be on the smaller side. In terms of protein, protein is definitely necessary during pregnancy to build baby's tissues, blood, and immune system. And you want to incorporate a variety of options in your meals and your snacks. And this can include lean meats, low mercury seafoods, beans, lentils, nuts, seeds, eggs, and dairy. So those are all great choices in protein. Somewhere around 3 to 4 ounces, perhaps at each meal, and then 1 or 2 ounces, which could be like a string cheese is like an ounce, or a handful of nuts is about an ounce at snacks as well. So anytime you're having carbohydrates, it's a good idea to incorporate some protein, because that helps slow down the absorption of that sugar from the carbohydrates, and it keeps you more satisfied going into the next meal or snack. In terms of fats and fiber, just like anyone, even those that are not pregnant, we want to watch the saturated fat intake and choose mostly heart-healthy fats. So this would include things like olive oil and avocado oil, avocados, and nuts, and peanut butter. Those are all great options in terms of healthier fats. Fish would be another good option as well. In terms of fiber, fiber actually can help with blood sugars and cholesterol. It acts like a gel-like mass to kind of trap fats and sugar. Fiber is a non-digestible plant fiber, so we don't really absorb fiber, and it can help regulate not only your blood sugars, but also your bowels. So it can help manage constipation or diarrhea, which is sometimes a challenge during pregnancy. And it's found in lots of different foods, including beans and oatmeal and apples and berries. In terms of fluids, water is the most essential fluid. The recommended daily intake is about 8 to 12 8-ounce cups of water per day. So, often when we think about 8 cups of water, sometimes people aren't quite sure, well, what does a cup look like? So about 8 ounces, or a small cup like this. So about 8 to 12 of those per day. And one way you can determine if you're staying hydrated is the color of your urine. If your urine is particularly dark, then you perhaps need to increase your water intake. If it's kind of the color of hay or this light yellowy color, then you're probably getting enough fluids. Tips to stay hydrated. So keep a water bottle handy with you. It's really smart to just bring water with you. And especially if you have a water bottle that you know exactly how much is in there, and knowing, okay, I need 2 of these a day or 3 of these a day is a very good idea. Okay, physical activity. In terms of physical activity during pregnancy, it is recommended that you engage in 30 minutes of physical activity that is safe per day. So maybe not starting any new rigorous exercise regimens during your pregnancy, but definitely things like walking, water aerobics, prenatal yoga classes are all great options. Of course, avoiding any kind of exercise that involve lying on your back would be best. And yeah, bonus, so make new friends and improve your mental health by going to pregnancy-focused fitness classes. So if you can find somewhere where other women are pregnant and attending classes, I think that's a great idea. There's also a lot of online pregnancy-focused exercise programs that you can check out as well. Other recommendations. So sleep and stress management are not only good to consider during your pregnancy, but also very good to consider when we're talking about blood sugars. Women that do not get a lot of sleep, which sometimes can be a challenge when you're pregnant, especially if you're pregnant with other children in the home, if you don't sleep well, you tend to have higher blood sugars. So try to develop a relaxing bedtime routine. Keep a routine bed and wake time. So try not to vary that too much. Make sure you're sleeping on your side. And stay well hydrated to reduce any kind of leg cramping at night. Goal setting is a really great way to make meaningful change when you're trying to make lifestyle changes. So when you're trying to make nutrition changes or physical activity changes, using the SMART goals is a great way to get there. Instead of setting these really lofty big goals like I'm just going to drink more water, making sure that your goal is specific, measurable, actionable, realistic, and timely is a very good idea, because you can really gauge your progress, right? So instead of saying I'm going to drink more water this week, you can make it more specific. I'm going to drink 9 cups of water this week. Is that measurable? Yes, you'll know if you met that goal or not this week, but per day for this week. Is it measurable? Yes, you'll know, right? You'll say, oh, you know what, on Sunday I only drank 7, and on, Monday I did my 9. Is it action oriented? Absolutely. It's something you can take action on, something that you can do. Is it realistic? So that is something that you have to determine. If you're only drinking 2 a day, is 9 realistic? Maybe not. But if you're drinking 7 per day, maybe 9 is realistic. And is it timely? Giving it a time. So for the next week, I'm going to focus on this. It just brings extra attention to it, and it really can help you see your progress. If you happen to be diagnosed with gestational diabetes, I always like to mention that this is something that is manageable, okay? This is something that you and your baby can still have very healthy outcomes with this diagnosis. And it can be very scary at times, but it is something that happens to women all the time and is very manageable, and they have healthy outcomes and healthy babies. This is all very possible. So if you're diagnosed, your OB, your doctor, your family doctor who's managing your pregnancy can refer you to diabetes education. At diabetes education, we'll talk about blood sugar goals, how to check your blood sugar, how often to check your blood sugar, when to do that, and what range should your blood sugars be for you and baby to be healthy. We'll also talk about nutrition. We talk about a really specific plan, one that works for you, one that is realistic, and something that feels enjoyable still for you, right? And then also we'll talk about physical activity. You know, what are you able to do? What are you currently doing, and where do you want to go with that? What kind of physical activity do you enjoy? So after baby arrives, you know, if you've had any kind of blood sugar concerns, and perhaps even if you haven't, but if you do, be active and make healthy food choices even after baby comes. It's really important that if somebody has elevated blood sugars, or if they're at risk for elevated blood sugars, that they stay active and still focus on healthy nutrition to try and prevent type 2 diabetes, or maybe even to prevent gestational diabetes in subsequent pregnancies. Explore breastfeeding, because breastfeeding can help reduce chances of type 2 diabetes for both mom and for baby. It can also help mom maintain a healthy weight postpartum after baby arrives. And role model healthy lifestyle choices. You know, if you're active and you're choosing more vegetables and choosing whole grains and making healthy choices, then your child is likely to do that later in life as well. Thank you. If you have any questions about diabetes during your pregnancy, please talk to your doctor about a referral to meet with one of our dietitians. If you're interested in other classes related to birth and infancy, there's breastfeeding classes, gestational diabetes, grandparenting, car seat safety, and you can visit our webpage at islandhealth.org/classes. Thank you for being here, and I wish you all the best during your pregnancy.